The program for all-inclusive care for the elderly, known as PACE, is moving to Norfolk. That's good news for caregivers who work during the day and for the patients who depend on its care. Sentara Life Care President Bruce Robertson and Program Director, PACE Program, Sentara PACE Program Director, Suzanne Coyner, tell us why. I'm sorry it took me so long to get all that out, but thank you very much for joining me to talk about what Sentara PACE is and how it assists people in the community. And the fact that it's moving to Norfolk is always good for the city of Norfolk. So where is it going to be located?
We're really excited to be located in the Janif Shopping Center, 5900 East Virginia Beach Boulevard. It's very close to our previous site and very good visibility, and we think that the location is going to be ideal for the services that we offer.
So easy access and parking and all of that is
absolutely
is good.
And close to a lot of the services that we currently utilize with the hospitals and the specialists.
Right, okay. That would make sense too, because you've got Sentara Lee right down on Kempsville Road. So you're just a little shot down the street. That's good. And the PACE program itself is not a Sentara creation per se, but it is a part of what Sentara offers in terms of a federally funded type of program. So.
Yes, PACE is a national program recognized by Medicare and Medicaid. There's about 130 programs around the country that's serving close to 35,000 beneficiaries. So it's been a program that's been around since the 80s. In fact, Sentara, we were one of the earlier adopters in Virginia. We were the first to start it, and we've been in our existing location since 1996. So we're excited about expanding into the new location, and next year we'll be celebrating our 20th year of serving Hampton Roads with PACE. So we're very, very happy to be able to do that.
Okay. When you speak of beneficiaries, are you speaking about a particular age group, or is this does this span a variety of ages? The program here.
Those that are eligible for PACE are typically, over 55. They're nursing home eligible. They live within the area that we can serve, which is all the localities of Chesapeake, Norfolk, Portsmouth, Virginia Beach, and Suffolk, and able to live safely in the community. So that is anyone who's eligible for Medicare and Medicaid are appropriate for the program, meeting those qualifications.
I can see why the location would be good too, because it is pretty central and easily accessible to the interstate and all of those things too.
Very much so.
So you have to qualify. You must qualify for nursing home care. So the people who might be at this locality or this particular location when it's finished are there during the day, and then their caregivers would come and get them, or they would get a ride.
So actually, we are responsible for those patients, or participants as we like to call them, 24 hours a day, 7 days a week. And so the day center is a fantastic component of what we offer, but it's only a small component of what we offer. We have a full service clinic on site with a primary care physician, nurse practitioners, registered nurses, LPNs. We have a therapy center. We have social workers, registered dietitians, a massive transportation network, home health care services. We provide a comprehensive care plan for every individual who attends our center. So the day center is very important, and as you said before, it gives people the opportunity to work and allow their loved one to come to the center for socialization or for supervision. But it's a component of what we offer, and our services are very extensive.
Wow, so yeah, there's a lot more than meets the eye for sure. And with the expansion of the space, you're going to be able to offer some things that you weren't able to offer before, or are now deciding yes you can, because you've got the funding and the money and the space and the ability to create those areas in the building to provide what you need.
It'll actually allow us to do several things. So we designed it with the idea of how to make the function of the building better supported. So we have the day center, we have the rehab center, we have the clinic, and they're very adjacent to one another. We also have a kitchen where we provide food. So now in this new environment, we have newer facilities for the gym. We have private exam rooms. We are coming up on our electronic medical record in the December of this year. So it'll allow us to incorporate technology in a newer building with better wireless access points. Again, it's just a larger facility, something that's been updated for the time that we live in, and it will allow us to offer services to even more individuals living in the community.
Okay, great. So having more people be able to avail themselves of this is important and pretty timely when you think about how the need is growing.
Absolutely.
You've seen a lot of changes in the program since its inception here?
It's continued to grow. As you may know, we have a second operation in Churchland, right off of Western Branch Boulevard, and so we're beginning to make sure that there's full access all over Hampton Roads. So it is being able to offer to families in the community who are caring for a loved one, that ability to allow folks who are becoming more frail the ability to remain independent without having to be institutionalized.
Yeah, that's a huge thing. It's important. I know that it's sweeping the nation in terms of a trend, but it's also hugely important to the individual who may have been more isolated in a setting that removes them from family and friends.
Well, and Bruce touched on something very important. It's allowing people to remain in the community. Yes. I have elderly parents myself, and so the ability for people to be supported in their caregiver role, to allow individuals to maintain their independence and improve their functionality. A lot of people who are nursing home eligible still are physically intact for many of their functions and are cognitively intact. And so we try to maximize that through the services that we offer so that we can, just offer a better quality of life. And that's probably the most rewarding part of this program, is we hear day in and day out that we make a difference not only in the quality of their lives, but their relationships with their caregivers and just the happiness that they experience. And so we're really excited about the opportunity to expand into the new center, to have it kind of to match the upbeat environment that we feel like we provide, and to be able to offer these services for additional individuals.
Okay. But to find out more about this, how can people call and find out? Is this a referral process, or is it something that people can take it upon themselves to check into for their loved ones?
Certainly they can call the centers directly. We have a 1-800 seniors number that people can call, and they can be directed towards the PACE program. We welcome walk-ins. So anyone can ask about the program. We take people through the building on tours. Just reach out to us at any time and make a phone call, and we're happy to answer any questions that we can about eligibility.
Okay, well, great. So congratulations on the new facility, and also, 20 years coming up next year, so you'll have a lot more even then to celebrate. But being able to have an upgraded building that's keeping up with the times is hugely important. With the pace of technology, it's often hard to keep up. So good to hear it, and I know this is great news for our older residents in the community, of which we will become if we're lucky one day, because we're certainly not there yet.
Not yet.
Not yet. Thank you so
Appreciate
much.
you sharing the information and coming on the show.
Thank you for having us.
Yes.
If you're raising a relative's child or children, you may benefit from our next topic, so stay right where you are.